I'm back at the Chevy Chase Cosmetic Center to see Dr. Lotsikas. I was here a few years ago and she did a beautiful job on filler right in here. So I thought I'd take advantage of being here to see her again for a little touch-up.
Hi, Jenny. How are you?
Hi, Dr. Lotsikas. Good.
Nice to see you.
Nice to see you too.
Good to see you. Look great.
It's been a couple years.
It has been a couple years.
Yeah.
Things going well?
Yeah. Oh, yeah.
Great. Great.
I can't believe how long this lasted.
It's unbelievable.
It's so unbelievable.
I was just going through before I came in and looking at your chart when we originally started this process, which was about 5 years ago.
Yeah.
And we have seen each other once about 2 years ago. We did a little tweaking, a little touch-up, not a whole lot. But it is amazing how beautifully...
It's exactly what you said it would be. You said it'll never be as bad as it was. And if I never touched it up, it would still always be better. I'm a believer.
Absolutely. You know,
yeah.
The beauty of the fillers that I think really makes it special, it's a win-win situation. So for patients that have never done it, that are a little bit nervous, I always tell them exactly that. You know what, it's going to stimulate new collagen, we'll go slow, we'll build it up, and if you really don't want to do it again, fine, you'll be better for it. And most people, I think the majority, if not all, say, you know, I really love this.
Jenny.
Hi, how are you?
I'm well, I'm well. Okay, so I just spoke to Dr. Lotsikas. She wants me to put up a little bit of numbing cream on your face. You're going to sit here for about 20-25 minutes while it's numbing you, and then she'll come in and start treatment.
Okay, great, thank you.
This makes the initial needle stick almost close to nothing. You barely feel it. We don't actually put it on the lip, but if your mouth and tongue starts getting numb, you know, you can let me know.
Okay, hi Jenny. Feeling nice and numb?
Yes, yes.
Okay, great. All right, so we'll get started shortly. I think today, after talking to you and reviewing what we've done before in the past, I think we're going to try something a little bit different than what we've done before, expecting the same results. Natural, not overdone, building upon the collagen, and still using within the Juvederm family that hyaluronic acid, which we know and love and trust. So I think that's really important. Great. So I do love Juvederm. Looking at you, I feel like you need more of a lift than a fill, so that's why I'm going to choose the velour, which is new. New to the family, not a new product as far as putting something different in, so to see. I know we've numbed, but it's always good to put some ice on before. That helps to constrict the blood vessels to try to avoid, I'll have you hold it for me, bruising. So I can always see the results right away. You have to be able to see a little bit for the forest or the trees, because right afterwards, we have some redness, we have a little bit of swelling. Sometimes you can get a little injection site, you know, pinpoint bruising. Sometimes people who bruise very easily get very large bruises. So hopefully we won't have that issue. That's why we're using the ice. And we tell our patients to avoid aspirin and ibuprofen and fish oil and things.
For how long?
About a week before.
A week before. Oh, I've had ibuprofen last week and fish oil.
Okay. So if you get it, so it doesn't mean that you can't do it, but if you get a bruise and you didn't have one last time, you're like, gosh, wow, I got a bruise this time. That would be the reason why.
Okay. And afterwards, not use it too?
Yes, I would avoid it for about a week afterwards.
Okay.
Tylenol would be fine to use, but I wouldn't use anything that would thin the blood, because the more you thin, we're sticking a needle, then that's how it's easier to get the bruise.
Right. And fish oil affects it?
Yes, that's why people take it to try as an anti-inflammatory.
Wow.
So actually, yeah, I think even fish oil is even more so than ibuprofen.
Really? Wow.
Yeah. So for future, we know not to take it before. Again, it is not a contraindication. So for example, some of my patients that need to be on aspirin for their heart, they may continue taking the aspirin. I just let them know that they might have some bruising, so that when we plan filler, we don't want to plan a huge important event the day of, I think it's always good to give at least 2 weeks between an important event for everything to settle down and look good. And if we have to do any tweaking afterwards for the Botox a week later, that we have enough time to think to look really perfect before an event. So ideally, if there's a huge event, I would give at least 2 weeks, 2 to 3 weeks before, if there's something very important going on, just in case there's anything. But usually there's no issues at all. Okay? So we're going to do a little pinch. Remember, it's a little pinch before we start. Okay. And I want to run feels a little bit sensitive. Just remember to breathe through your nose. Don't hold your breath. You okay? Mm-hmm. All right, that's a little uncomfortable there. All right, I'm gonna go a little bit up here. All right, let me take a little break for a second.
Okay.
I'm just gonna do a little gentle massage, just to see what it looks like. We did that before, so to ask you to open your mouth up a little bit for me. I'm just gonna just gently push. You don't have to stretch it that much. You can relax your mouth. And that's just to soften the product. The product is a little bit thick, so if you leave it in, it feels like a little ball. We don't want that. So we just kind of want to gently massage it into place. You don't need to massage anything. I will do that for you. And that just kind of leaves it nice and soft right there. All right, let's do this. Let's put a little ice, because I know that was a little bit uncomfortable. There. And you put it over here. And again, like before, we're just going to do a little bit, take a look, and then add more. We don't want to overcorrect. Okay? So I'm just going to come on the other side. All right, Jim, you can keep the ice there and just take this one off. Okay. And again, the marionettes, this is definitely a little bit deeper here. Now we want to go a little bit to lift that up. And just erase that around. Perfect. Beautiful, just bear with me. Good job. Show those little corners. They certainly like to go down as we get older. So I think it's really important too that as we get older, we want a neutral lip. So we don't want our lips to go down where we look sad, but we don't want the lip to go up where you look like the Joker. That's not good. So what's really important is at rest, what we're looking for as a nice result is that we get a neutral lip so that when we smile, everything lifts and goes up and looks very nice and very natural. So I think we did that. And that's what I'm going for here. Even if there's a tiny little bit after we're done, we can always go back and add a little more. But open up your mouth for me, dear. Thank you. And remember, these things always look better a week, 10 days later. 2 weeks. I even think personally, even everything, the Botox a month out looks awesome because it softens. You know, sometimes when it first comes on, it needs. It's doing its thing, and then it just settles in and looks really nice and softens.
So here I am 5 years later since you last saw me. I've seen Dr. Lotsikas one time in between for a little bit of a touch-up, but this time I felt like I needed more. So I had a little bit more filler, some Botox, and even just a little bit of filler around my lips, just to kind of fill it in a little bit. And I feel like I got rid of some of those aging wrinkles. Okay, so it's been a month since I had my treatment, and I'm so happy with the results. It's great, but I learned a few things this time. First of all, if you have an event, you need to pre-plan, because I had a little bit of swelling and a little bit of bruising. The doctor, of course, told me to ice right away, but I was looking good and feeling good, so we went out to lunch and I completely forgot, and I didn't ice. So I did end up with a little bit of swelling, but what I realized, what works really well is frozen peas. Frozen peas really worked great, and arnica cream. I had a little bruising and it took care of that really quickly. So the other thing is, I had asked the doctor to not go too close to my eyebrows with the Botox, so I ended up needing a little tweaking because of that, and it was no big deal. She fixed it. It was all taken care of. But so you need to pre-plan, so you have a little bit of time. Don't do this too close to a major event, so you give yourself that time to heal and for any tweaking. But other than that, I'm happy, and
and I think I'll just need maybe once in a while a little bit of maintenance.